Welcome to Amazing Interviews. My special guest today is Professor Christopher Granger from Duke University. Welcome here, and you have a wonderful record based on participation in our meetings. And I'm thankful to Dragos, Professor Dragos Vineranu, who introduced you to me. And please share some interesting points from this nice story.
Well, thank you, Dan. It's so great. First of all, it's so great to be here. I love visiting Romania. You and Dragos and Andrea, other close friends here now. Almost, I feel like it's part of my family. And that's for me, one of the best things about what we do, what we have the privilege of doing, being cardiologists, being involved with education, with research, is to do things that are important because they help other people. Because cardiovascular disease is the number one cause of death and disability in the world. And we do very important things for our patients. We help other people, stimulating way, challenging, and we do it, and then we do it with people we like to be with, like you, for example. So this is the greatest privilege, and it's so great to be here. I do feel like I have a special connection with the Romania cardiology community, largely through early work with Dragos doing clinical trials. I think maybe the first large one was the Aristotle trial, where Dragos
Everybody's knowing about Aristotle.
It was a great trial, and Dragos was Romania was a very important part of it. And then Dragos got me involved with the university, with Carol de Vila University,
the
where
biggest university of medicine in Romania. Yes, in
and
Bucharest.
I have the privilege of having an honorary degree there and visiting several times. And then the other thing that Dragos has been so good at is not only generating evidence about what works, but asking the question, how can we better implement it to
Yes.
improve the lives of our patients?
Yeah.
And that's another major area of exciting research and a major kind of objective that we all share. I know you're passionate about this, working on prevention. How do we get prevention applied earlier in the process? Because the best thing we can do is prevent disease. That's the best thing.
Thank you so much for this very kind message. And you are a very successful cardiologist. So please, are there specific ingredients of being successful in your career?
Well, the nice thing about a career in medicine and cardiology is there's so many different ways to be successful. I think the most important thing for me still, nothing more important than sitting with a patient and coming up with a treatment plan, with advice to improve health, right? That's working with the families, the patients, improving health. But for me, the most important ingredients are to be passionate about what we do, because that's what drives us every day to get up and say,
that's the fire.
Today we have amazing opportunities to do things that are good to do. To be curious.
Mm-hmm.
I think I heard a statistic that now, with information increasing so quickly, the amount of medical information in the world doubles like every 9 months. So there's so much information, and how do we stay curious and make sure we incorporate new ideas in how we play our daily lives? One of those is artificial intelligence, right? That's going to be really important for the future. But so curiosity is also important. And then I think for me, a very important thing has been to have a bit of diversity in what I do, so that I don't do exactly the same thing each day. So that I do some patient care,
Mm-hmm.
some research. I think ideally we should all incorporate
The
some
combination of all these things.
generation of new evidence when we take care of patients. Ideally, be that through clinical trials or registries or whatever we do to help in generating new evidence. and then in teaching the next generation. And all three of those for me are so important.
Wonderful answer. You are very active. You are a hard worker. You are enthusiastic in doing sports. We ran together up to 2,000 meters here in Sinai. Is it possible to share with us some some aspects from a perfect daily work where you when you wake up about the meals and about the balance between rest and work?
Yeah,
Please.
I love the way you ask that because you can talk about things in general, but like, what do you do? How about today? What are we gonna do
Yeah.
today or tomorrow or when I get back to work on
Yes.
Monday? Um, and so for me, uh, I have a great family. That's kind of the foundation. Um, Brady, my wife, our three kids. Um, and then Brady's very athletic, so that forces me because I feel much better when I'm active, like you.
Yeah.
Like you said, we run together each year. Um, so the day should include. I'm kind of obsessive compulsive about steps. If I don't
Wow.
get my
Counting every
yeah,
day.
like average about 11,000 steps a day. If I don't get nearly to that, then I'm feeling
So more
like
than 10,000 is perfect.
more than 10,000. Yeah. But ideally some exercise. When we get up, uh, we have a dog. The dog is part of my life. It helps calm me down. For breakfast, I have a latte and a banana. That's my breakfast every day. Pretty simple, but then I know it's
Right.
not complicated. And then about half the time I'll have patient care. I'll round on patients in the hospital or have clinic. And then usually, even when I do that, there's usually some time each day that I'll do some either teaching or research activity or work on a manuscript or work on what are the next questions to ask, what are the things to work with our fellows on. And then at the end of the day, try to relax and try to um, um, spend some time. I don't really watch TV, very little. More relax and maybe do a little bit of reading. Like I just finished this book about Paul Farmer. He was the public health leader who did a lot of work in Haiti and Peru and Russia on tuberculosis and HIV. And he was a remarkable person. I think reading about people who've been able to overcome some of the barriers that we face every day is inspirational for me. So I try to do some of that as well.
How many hours sleep per night?
Uh, I try to sleep at least 7 to 8 hours a night. I like to sleep. I like.
It's good. It's healthy. Thank you for all these things. So you've met already many young cardiologists here in Romania. Sometimes we are perceiving that we have a different life than the rest of other countries. Sometimes we are perceiving that we are a part of this strong community. Do you have a message for young cardiologists in Romania?
Yeah, I think for young cardiologists in Romania, the patient is the same in Romania, because I've rounded in the hospital too, in Bucharest. The patient is the same in Romania, in Durham, North Carolina, in France, wherever. And so I think we're all have to address the same general issues. Now, we may have different resources. Our patients may have different ways of dealing with things, but I think fundamentally, this important for me. Fundamentally, we're a global community. We're
Exactly.
dealing with the same
Trying to find
types
what
of
we have
things,
in
and
common.
that's why sharing is so important. Because I learn so much when I come to a place like Romania and hear about the challenges here and how you're addressing them and how you're overcoming them. So my message to young cardiologists in Romania is um, the work you're doing is extremely important, and uh, and take advantage of that. Keep learning. Even when you're young, keep teaching the new people who are coming the year after you, the year after that, because being part of the community, working together to make all of us better, is so important.
Wonderful. At the end of our short talk, I selected 3 questions from a famous questionnaire built by James Lipton, interviewing Hollywood celebrities. And we as cardiologists, and especially a leader like you are in the light of all these things. So first of all is what turns you on creatively, spiritually, or emotionally?
Yeah, I was just talking with Filippo Crea at this meeting, for example, about a patient that I saw last week. There's still, it's incredible to me. Every person we see has challenges and issues, and sometimes interesting and challenging things. So just this simple aspect of caring for a patient and their different presentations is something that really excites me. And I think that's kind of some of the fire, right? Is in patient care is how do we figure things out and do the best we can caring for a patient. And then the other thing that so that's the foundation. But then for me, kind of the pinnacle may be like, because I'm a clinical trialist.
Yes.
So when we do years of work on a clinical trial, and this happened to me actually today, this week, a major trial. We just looked at the results, and it'll be presented at AHA in a late breaker. But looking at the results of a clinical trial for the first time, it's almost like opening up a Christmas present. It's like
Yeah,
so that
it's
really
the
excites
energy
me.
and the passion and all these positive feelings. What profession other than your own would you like to attempt?
Well, that's a great question, and it's a question that we always ask, like our children, right? What are they doing? Two of my children went into medicine, which surprised me a
It's a
little bit
tradition
because
already.
they always thought they knew I loved what I did, but usually they didn't want to do it because they thought I spent too much time on it, and I wouldn't come home till late at night a lot of times, and they thought they wanted to have a life that was more balanced with personal life. But now I think they've realized that there's great opportunities in medicine, and the other one's a lawyer, a public defender. Um, but for me, I think I've got lots of friends, and I also
We are
considered
doing advocacy as doctors anyway.
exactly, yeah. So one area that I think I would have also loved would be teaching, simply
Mhm.
teaching at a high school or
You are a
university
famous
level.
teacher.
Well, we do
Professor.
teaching, don't we? But I think you can have so much influence on people by being a thoughtful, supportive teacher uh, to make a difference in people's lives. So that's another area that would be good.
We have a wonderful profession, both of us. It's not only about being doctor and treating and healing, but also advocate or teaching. And so probably it's a part of our complex structure.
I think we're so fortunate, Dan, and I'm so fortunate to be a friend of yours. So I
Oh,
really, and a
thank you so
friend of
much. And
Romania. I really appreciate being here.
another question is about what profession you don't want to have, you
Oh,
dislike to have, or
well,
it's putting outside of this.
so, you know, again, this proves how lucky we are. I wouldn't be happy doing something where I did the same thing every day that didn't involve
Monotony,
meaningful
yes,
relationships with other people. And
exactly.
so many people have to do that type of work that I'm so grateful that, and it's important for our societies that we have people who are doing manufacturing and, programming, computer, all these things where you have to dedicate yourself to one single thing and do that on a continual basis without so much interaction with other people. But for me,
All these professions are there, but also they permit us to be, I don't know, to be in the light of things, to be creative and
that's
to be
right.
passionate.
That's right.
It's a pleasure to discuss with you, and I'm thankful for these minutes spent together about all these things. Thank you so much, Steve Chris, and welcome in Romania every time you want.
Thank
Thank
you,
you
Dan.
so much. Thank you.